I'm Dr. Mikio Nihira, and in today's video, I'd like to talk to you about bladder control problems and specifically urinary incontinence or having leaky bladders. Bladder problems like urinary incontinence are incredibly common. In fact, in the United States, it's estimated that over 18 million women have urinary incontinence at least once a week. There are two basic types of urinary incontinence, and about 60% of the ladies that I see have some form of urge incontinence, or the other word we use is overactive bladder to describe their condition. In this situation, ladies have a strong feeling to need to go preceded by leakage. The next common problem is stress incontinence, which is a problem of the valve of the bladder not closing tightly, so that in this condition, people leak with coughing, laughing, and sneezing. Lastly, mixed incontinence is a mixture of stress and urge incontinence, and this is another very common form of leakage problem. Continuous leakage problem with fistulas is fortunately in the United States a relatively uncommon problem, but is an issue if the person has had an injury, typically at the time of hysterectomy. So this is an illustration over here on the left side of the screen of overactive bladder. And it's important to understand that the bladder is a muscle. And that muscle normally relaxes until we're ready to go to the bathroom. If people have any trouble controlling their bladder, and it's important to understand that it takes us, when we're born, 3 to 7 years to get our bladder under control. So if we have any trouble communicating between our brains and our bladder, then we will have overactive bladder. By age 65, it's estimated that 1 in 3 Americans have some degree of bother from overactive bladder. In contrast, stress incontinence is a problem of the valve of the bladder. I call it a mechanical problem. So this is the valve that I'm talking about. It turns out that women have a much larger, in terms of diameter, valve than men, and it points straight down when they're standing up. So if they're not able to close that valve more tightly, then they will leak urine when they're coughing, laughing, and sneezing. Treatment for urinary incontinence is very individualized, and it depends on, number one, the type of incontinence that's bothering women, and even women who have mixed incontinence tend to have one type that's bothering them more than another, so the treatment varies depending upon which type. For all types of incontinence, generally there are non-surgical things that can be very effective, such as lifestyle changing, and that can be doing things like drinking liquids on a specific schedule, or avoiding certain liquids such as alcohol and caffeine. Doing a bladder diary. A bladder diary is keeping track of what you are drinking and when you are urinating, and this can be used to influence your activity for bladder control. Kegel muscle exercises can be very helpful, especially to augment that closure of that valve called the urethra with coughing, laughing, and sneezing. Typically, this is best done under the supervision of a physical therapist using biofeedback. Important to say, a combination of treatments may be needed for best effect. And in particular, sometimes people need treatments for stress and urge incontinence. And at times people have problems of bladder leakage that are so bad that they need multiple surgical treatments to improve. For overactive bladder, what I have on the left is a graphic from the National Association for Continence. It's a very good website if you need more information about incontinence, in addition to the American Urogynecologic Society. But it's talking about over-the-counter products. It can be medicines, to help relax the bladder to improve overactive bladder. There are prescription medicines like Detrol LA, and there are procedures that can be done in the office, such as tibial nerve stimulation, that can be used to reduce the activity of the bladder. For women who don't respond to less invasive treatments, such as medicine, behavioral change, or tibial nerve stimulation, there are other treatments available for overactive bladder. One of the most common ones that I perform is Botox injections to the bladder. In this picture, you see an illustration of a doctor injecting or placing a cystoscope into the bladder. That's this long tube, and you can see inside the bladder with this tube. And they're using a needle to inject, in usually about 20 places, a small amount of botulinum toxin to temporarily paralyze that small portion of bladder muscle to reduce its activity so people can fill their bladder better and not have as much urgency, frequency, and urge incontinence leakage. Down here on the left side of the screen is an illustration of something called InterStim, or Sacral Neuromodulation. There are now 2 companies producing this kind of technology. In this treatment, electrical stimulation is placed directly to nerves through an implanted device. The device is usually implanted under the skin of the buttock. For stress urinary incontinence, there are non-surgical treatments such as pessaries. There are 2 displayed in this image. The first is here on the right side of the screen. This is an incontinence pessary, which is a ring with this knob, which is to be placed underneath the urethra. In this illustration down here from Poise, you can see that a device similar to a tampon, in this case it's called Poise Impreza, can be placed in the vagina temporarily, and it fills up to compress the urethra to reduce leakage with coughing, laughing, and sneezing. These are things that can be obtained over the counter, and you don't need a prescription. We are very lucky in Southern California to have many physical therapists, or specifically pelvic floor physical therapists, available to us to treat our patients with urinary incontinence. Typically done with some form of biofeedback, which is an example is shown here on the bottom right of a Kegel perineometer. This was a device developed by Dr. Kegel to help instruct women how to squeeze the muscles around the pelvic floor. What we've learned through clinical trials is that women who have troubles with things like overactive bladder and stress incontinence and other urogynecologic problems frequently have trouble identifying these muscles and maybe doing counterproductive things such as bearing down when they're trying to squeeze the muscles around the vagina. And through a biofeedback device such as this, or something smaller and less intrusive, this can be very helpful to improve bladder control. There are many surgical treatments for stress incontinence for those that don't get better with non-surgical treatments. A common approach is to do what we call a bladder sling, and that's illustrated in this picture. And this is essentially a hammock placed under the urethra. It can be made of synthetic material like plastic mesh, and that's the least invasive option, but it can also be performed using one's own connective tissue, such as the connective tissue from the abdominal wall. Important to know, these are very successful procedures, but in the case of using plastic, you're using a material which is permanent and can have issues of exposure and other troubles. There are urethral bulking therapies, and that's illustrated best in these pictures below, in which you can see a relatively closed normal urethra at rest. There are patients who unfortunately can't close their urethra well, and it's relatively open at rest, which is being shown here in the lower left. In this procedure, which can be performed in the office, material is injected into the wall of the urethra to make it close more tightly. Unfortunately, this tends not to be a very robust procedure. It frequently needs to be repeated between 2 or 3 times during the first year and subsequently thereafter. This is an illustration of how it's performed using a cystoscope. That's this device here. And we can look down the cystoscope to see the urethra and inject material, being shown here as a needle is injected into the wall of the urethra. At present, the most common way this procedure is performed is using synthetic material, typically materials that were developed for cosmetic reasons such as bulking the lips. There is currently a trial undergoing using one's own connective skeletal muscle cells that can be grown in the laboratory and then injected back into the urethra. This is a very promising approach, but it'll be another few years before we know if this is an effective approach for treating stress incontinence in women. To conclude, it's important to understand there are different types of bladder leakage problem. A common type is mixed, where I see a mixture of both stress and urge incontinence. And in this condition, frequently multiple treatments to independently treat the urge incontinence and the stress incontinence are needed to be optimal. Please contact us for any questions or concerns at 844-827-8000. Ask for Women's Health. There are many online resources available to women who have bladder control problems, including the American Urogynecologic Society and the National Association for Continence. Please like this video and leave comments so that we can create more videos to address your questions.